Hi, this is Kim, HE Health YouTube channel and si-instability.com Facebook page and website. Here's an impromptu update to let my followers know what I've been up to, where I'm at, what's coming up next. Okay, so we're 3 months since the last surgery at the right brachial plexus with an extra emphasis on decompressing the long thoracic nerve and the dorsal scapular nerve that innervate the serratus muscle and the rhomboids, which help control the scapular function. I had mild scapular winging along with my neurogenic thoracic outlet syndrome. I used to get pain up the scalenes here, up the side of my head. I would get some impinging in the shoulder. That is all completely gone now. I have complete, full range of motion of my shoulder. It's wonderful. I couldn't be happier. But I need the second surgery in January after I had the last surgery in September. Well, the last surgery in September was the pec minor lengthening and the decompression of that neurovascular bundle, along with the short head of the biceps lengthening, in combination with a slap repair of the shoulder. Labrum was detached. So that was all repaired. That was done arthroscopically, and I've healed wonderfully from all these last two surgeries. The deficit that I still have with the right side is my right elbow. It was getting diagnosed along the way as I was healing from these other things. And the bottom line is on valgus stress testing of my right elbow, I have gapping of the medial joint, especially under stress fluoroscopy. It could be seen. I have popping of the medial side of my joint. And there definitely was a tear seen under ultrasound. Yet my MRI was completely negative. I really do believe much more strongly in high-quality diagnostics with ultrasound and stress fluoroscopy because I can show the joint in motion. I really don't have a lot of joint effusion and swelling, but I don't tend to have a lot of swelling with any of my joints or anything, so that doesn't surprise me. So I'm just saying to other patients that when an MRI could be negative doesn't mean you don't have a problem. It's just about a doctor believing in you, doing hands-on examinations, and looking to other methods to diagnose besides an MRI. So that surgery for the elbow is coming up here very shortly, and once I rehab from that, I'll be able to get back to full physical therapy rehab again. At this point, I've left off with doing the strongest bands, like the black bands in PT, and doing tricep pull downs, doing rowing, doing lats, doing all kinds of things for my shoulders, and it all feels great, minus weight-bearing loading onto my right elbow, say in a plank. I'm even doing planks, but I cannot, there's no way I can even take my other arm off the ground and put all the weight through my right elbow. It feels like it wants to buckle right through the right elbow. But as far as everything else in combination together, it's doing very well. I couldn't be happier. I'm very grateful to have had both my left side done back in 2016 and this side done, and just thoroughly enjoy the biomechanics of how my shoulders and neck and everything are now. After years of suffering neck pain and neck problems for years, after major whiplashes. I had 2 major whiplashes back in my in the early 90s, my early 30s. So those whiplashes can contribute to years of problems with your neck and scalenes. And I'm here to say now, I'm completely healed of all of that. I have a neck better than I even felt in my 20s. So there you have it. That's my update for the upper body at this point. And thanks to all my faithful followers and YouTube video watchers. We'll give more updates as we go here.